Good morning, everyone, and welcome to the 15th Annual Lorne Sullivan Research Day in the Department of Urologic Sciences. This day is really honoring the prior chairs that have helped shape our department, grow our department to what it is today. Lorne Sullivan, I think, really helped catalyze that growth by bringing people together, really encouraging an environment of collaboration and cooperation and partnership across urology, other disciplines, and ultimately helping raise funds to grow the science aspects of our department. And Larry certainly took that to a whole nother level as well. So thank you for these contributions. Normally, Chris, this is a full day affair with about 50 posters up as well. Like any research day, really about bringing people together to showcase what, to really showcase and celebrate research in our department, helping to connect our work, since more often than not, research is programmatic, taking our clinicians and scientists across departments, faculties, other institutions, and even sectors across Canada and the world. And so this day is meant to, let us know, share our work, and appreciate what is going on, help shape an environment of partnership, innovation, and translational research where clinicians and scientists partner to focus on clinically relevant challenges and ultimately help transform the future of medicine. This past year has continued to be a challenge, and I want to thank everybody in our department to adapt to this strange world. And we've done a great job, even with a part-time occupancy in the research building and clinical trials. And I'll come to that from an output point of view, but we did have a 10-year external review mandated by the faculty. The reviewers are listed here. While it was completed more than a year ago, it went through the final processes within the faculty over the past 6 months as well, and really highlighted the excellent growth that has occurred over the past decade in the department, and really, I think, ranks us, and it states it, and it ranks us in the top 3 urologic departments in the world from a contribution point of view. Over the past year, despite COVID, we've had 35 new grants totaling more than 27 million in the department. Despite challenges in clinical trials, we still enrolled more than 200 people in therapeutic trials, over 400 in biomarker trials. We completed a first-in-man trial with a drug out license from UBC to a spin-off company, attracted $5 million for a North American-wide novel neoadjuvant trial, and continue to move forward with significant publications, 190 across the prostate center and the rest of the department, a significant number of patents, new drug products, and even out-licensing deal, despite the challenges of COVID over the past year. And as such, we've been recognized by internal and external awards noted here. Our Cherkasov Distinguished Achievement Award in Foundational Science from the faculty. This is the 3rd year in a row that somebody in urologic sciences has received that, with Alex Wyatt and Amina Zubaidi in the preceding years. Michael Cox highlighted for one of the top teaching awards within UBC. Lynn Southers, the Victor Politano Award at the AUA. Helen Wong, our admin assistant, was awarded the top staff service award in the faculty. And this year we've been targeted to be awarded 2 Canada Research Chairs to the department. So really an outstanding year of achievements. I want to call out a new award that was enabled by a generous donation from the Wasson family. And this is an add-on to this year's program. We won't be able to actually put it into the program. It will be an annual event. This is a donation that is meant to support a training scientist by the Wasson family. and it's more details on this can be found in the on the websites now. I want to thank the Wasson family for enabling this, and Michael Cox has helped oversee the adjudication of this award, and it was awarded to Dr. DaCosta in Alan So's lab for her research in novel therapeutics in kidney cancer. So congratulations, and again, thank you to the Wasson family for providing this award this year, and again, this will be incorporated into future Research Day programs. There. So again, I just want to highlight our outcomes over the past decade, something that we can all be proud of. You should all be, I think, aware of sort of our trajectory, and because you're the ones that are contributing to this over the past decade in terms of patents filed, research grants, contract research agreements, new clinical trials, number of publications. Again, it's just a significant output throughout this past decade, over 1,500 publications, close to $140 million in research grants brought in over the past decade. And this trajectory is just, again, illustrated here in terms of a continuous input of significant infrastructure and operating grants, placing the prostate center ranking only second to the brain center as far as most dollars brought into the university, but we have about 1/5 the number of faculty as the brain center. And this is demonstrated from an IP point of view. And just today I received a notice on the top 100 universities in the world for patent output. And UBC was the only one from Canada in the top 100, ranking about 42nd. And within the university, the Prostate Center is #1 in terms of patenting per PI. And so again, it places this into perspective, just the output that you are all producing, both in terms of publications, patents, as well as out-licensing into newcos. So with that, I'm going to move on with the agenda. I want to thank the sponsors, Bayer, AbbVie, Pfizer, Tercera, Roche, Astellas, and Sanofi for all contributing to help make this day possible in terms of bringing in guest speakers and helping to support the training within our department.
So on behalf of VCHI, it's my utmost pleasure to welcome you to the 15th Annual Lorne D. Sullivan Lectureship and Research Day. It's also a special privilege to welcome Dr. Sullivan and congratulations to Dr. Barbieri, who will be speaking and presenting the keynote lectureship in his name. Since its inception, the Prostate Center, as Martin said, and I should have checked my slides with you, Martin, because some of them overlap a little bit from different ways, but the Prostate Center has been a leader in translational research, clinical implementation, commercialization, not only in BC, but as Martin says, on the international stage. For those of you unaware, Vancouver Coastal Health Research Institute is Vancouver or Western Canada's largest hospital-based research institute, comprising over 1,500 investigators, or investigator staff and graduate students, 350,000 square feet of space, and anywhere between 100 to 120 million of research funding in a given year. It's comprised of all these different research centers across the VGH campus, including the Prostate Center, as well as the UBC Hospital Center for Brain Health, GF Strong, Lionsgate, and Richmond hospitals. And to keep this in mind when doing clinical trials, you may be able to access patients out of these centers as well. In addition to this, while much of our focus is on Vancouver acute, we must not forget we also have access to a wide array of ethno-cultural diversity across care homes and long-term care across the province, as well as Indigenous people that is fairly unique and often appealing to have that diversity for clinical trials. With respect to, I think I got the same numbers as Martin, but I just wanted to point out here, when you look at the Prostate Center's output over the past 10 years. My numbers are from 2010 to 2019, but when you look at it in comparison to the rest of the University of British Columbia with center-based inventions and patent filings, The prostate center is batting way above its weight when you consider that UBC is one of the top medical research institutes in the world, and you look at how much output is actually coming from the prostate center. So congratulations for that spectacular output that you've had over the past 10 years. We're currently putting together a list of spin-out companies that have also come in at VCHRI. We're trying to do more to break down the barriers for those early stage discoveries to get them into clinical practice, and when necessary, being able to facilitate when we can, getting these into the marketplace if warranted. In order to do this, we must ensure, as the Prostate Center has been doing, that we stay at the forefront of the latest technologies available that we can bring to bear on cancer as well as other therapies. Never before has there been the need and demand for scientists and clinicians to be working hand in glove together to foster the best personalized preventative and treatment strategies. From a VCHRI standpoint, we recognize this, and they're looking forward at ways of better equipping our clinicians with the best treatments to get to our patients. And this will obviously be guided by the latest science. And one thing we've learned from COVID and Vancouver's success in this area with respect to technologies and the vaccines, where UBC was one of the two major universities with respect to intellectual property going towards Moderna and Pfizer vaccinations. And the other being University of Pennsylvania. The message take home for the year, I would say, is when universities, research hospitals, and industry work hand in hand together instead of fighting, a lot more gets accomplished in a much greater, much more efficient period of time. So we're looking at ways of improving relationships between the universities and the hospitals, as well as our hospital and other hospitals, and also with industry and welcoming industry as collaborators moving forward. I just put this in here because, and this is more to inspire the students, and the Prostate Center is such a great example of an institution that trains the next generation of researchers. But over the past 2 years, and of course, many of these companies have been around for decades, but the explosion in biotechnology companies over the past couple of years, to the fact that the government, both federally and provincially, are recognizing life sciences as a sector, with over 2,000 companies, 20,000 employees, $2 billion invested in British Columbia in life sciences last year, 1,300 clinical trials, over 100 sites. The government's starting to pay attention to these numbers and starting to invest in this area as British Columbia moves from the traditional resource-based economy into a knowledge-based economy, focusing on health sciences, green technologies, and digital technologies. But as the BC and federal governments are investing heavily in this, we must also recognize that other countries, such as the US, which recently increased their NSF budget, I think, from $8 billion a year to $28 billion a year, is investing heavily in transferring technologies from the basic research labs and into practice. And we need to keep this in mind and do more moving forward to avoid the real threat of brain drain to other countries, and do more to retain our faculty as well as train students for the jobs in demand. And finally, from a VCHI perspective, we're looking at ways of breaking down these barriers to get our clinical innovations back to the patients. And we're exploring ways of doing this more efficiently. So any thoughts and ideas of how to break down these barriers and better enable promising discoveries and technologies that we hear about today to move quicker into practice are welcome. So moving forward, I think it's clear that now is the time for science to shine. And with that, I thank you and look forward to the day